Hi, Jim. My name is Brianna. I'm going to go over some lab tests that were ordered for you. I do talk fast, but if at any time you have any questions, please feel free to stop me and ask. So it looks like we're going to go over some liver function test. We're going to start off with the AST. So AST is an enzyme that is found mostly in the liver, but it can also be found in the heart and the muscles as well. High levels of AST in the blood could mean that there's some damage to those organs or the tissues. A normal range is 10 to 40 units per liter. Some signs and symptoms of high levels is pain in the upper right stomach area, as well as yellow skin and eyes, and then feeling very tired. Some signs and symptoms of low levels are muscle weakness and low energy. And then what could your results mean? So it could mean that there is some active tissue damage in the liver, the heart, or the muscles. The factors that can affect these results are medications such as Tylenol or opioids and intense exercise. Before the test, there are no limits on food or fluids. However, we are going to review your medications just to make sure there's no, interference with the results. During the test, there might be some slight discomfort from the tight band around the arm as well as the needle, and then 4 mLs of blood will be collected. After the test, there is going to be some direct pressure applied to the site to help stop the bleeding, and then you could resume any of your medications that were stopped prior. Do you have any questions? Awesome. Okay, so we're going to cover the ALT. ALT is an enzyme that's found more specifically in the liver, and high levels of the ALT in the blood can help determine damage to the liver specifically. Normal range for the ALT is 10 to 40 units per liter. Some signs and symptoms of high levels are yellow skin and eyes, and then not wanting to eat as much, as well as dark colored urine. Signs and symptoms of low levels are weakness, low energy, and then low levels of minerals and vitamins. What could your results mean? It could mean liver damage or inflammation, as well as fatty liver disease due to the diet. Some factors that can affect the results of the ALT test are diet, such as fast food, energy drinks, alcohol, herbal teas, as well as acetaminophen or Tylenol. Before the test for the ALT, there are no limitations on food or fluids, but medications will be reviewed again just to make sure there's no interference with the results. And then during the test, some slight discomfort from the tight band as well as the needle might be possible. And then we're going to be taking 4 mLs of blood. After the test, direct pressure is applied to the site to help stop that bleeding, and then you can resume any medication stopped prior to the test. So now we're going to cover the ALP. ALP is an enzyme found mostly in the liver, but also in the bones. And then high levels of ALP in the blood can help determine liver bile issues as well as bone disorders. So a normal range for the ALP is 50 to 120 units per liter. Signs and symptoms of high levels are going to be yellow skin and eyes, bone pain, itchy skin. Some signs and symptoms of low levels are numbness, tingling, and low energy levels. What could your results mean? It could mean a growth on the liver blocking bile flow or a bone disease. Some factors that can affect the results are diet such as fatty foods, and then supplements such as vitamin D, or age such as individuals older than 45. Before the test for ALP, fasting is required for at least 8 hours prior to the test. And then during the test, there may be some slight discomfort again from that tight band or needle. And then 4 mLs of blood will be collected. After the test, direct pressure is applied to the site to help stop the bleeding. And then you can resume your usual diet. I know it's a lot. Do you have any questions? Okay. Direct bilirubin. High levels of direct bilirubin could mean that there is a bile duct blockage. And then the normal range for direct bilirubin is anything less than 0.5 milligrams per deciliter. Some signs and symptoms of high levels are yellow skin and eyes, dark colored urine, and pale stools. Some signs and symptoms of low levels. Typically, low levels are rare and there won't be any symptoms. What could your results mean? It could mean a blocked bile duct or a liver disorder. Some factors that can affect the results are liver toxic medications such as Tylenol, antibiotics, and some others, as well as diet such as fatty foods and alcohol. Before the test for the direct bilirubin, you can continue fluids as usual, excluding alcohol. However, fasting is required for at least 4 hours before testing. And then during that test, some site discomfort from the tight band in the needle might be possible. And then 3 to 4 mLs of blood will be collected. After the test, direct pressure to the site is applied to stop the bleeding, and then you could resume your usual diet after. Then we're going to go over the total bilirubin. Total bilirubin, it could mean that the liver is not effectively handling waste. So this level will be tested to look at how the liver is functioning. A normal range for total bilirubin is 0.1 to 1.0 milligrams per deciliter. Some signs and symptoms of high levels are yellow skin and eyes, itchy skin, feeling very tired even after rest. And then some signs and symptoms of low levels. Low levels are typically rare and there will be no symptoms. What could your results mean for total bilirubin? It could mean liver damage or hemolytic anemia. Some factors that can affect the results are liver toxic medications such as Tylenol or antibiotics, and then diet such as food, fatty foods, and alcohol. Before the test, you can continue fluids as usual, excluding alcohol, and then fasting is required for at least 4 hours before the test. During the test, there may be some slight discomfort from the tight band in the needle, and then 3 to 4 mLs of blood will be collected. After the test for the total bilirubin, direct pressure is applied to the site to help stop the bleeding, and then you can resume your usual diet. I know it's a lot. Any questions? No? Okay. Albumin. So albumin is a protein that is made in the liver, and it is the most common protein found in the human blood. So the level is going to be tested to detect nutritional and liver status. Normal range is 3.5 to 5.5 grams per deciliter. Some signs and symptoms of high levels are dry mouth, lack of fluids, intense vomiting or diarrhea. Some signs and symptoms of low levels are edema, poor wound healing, and feeling very tired even after rest. What could your results mean? An increased level of albumin could mean lack of fluids, and then a low level could mean protein intake or improper absorption. Factors that can affect the results are medications such as insulin and aspirin, and then IV fluids or too many fluids too fast. So before the test for albumin, no fluid or food restrictions are necessary, and we will review the medications just to make sure there is no interference with the results. During the test, there might be some slight discomfort from the needle. 5 to 10 mLs of blood will be collected, and then after the test, a high protein diet is encouraged. Any questions? Okay, total protein. Total protein is a measure of all the protein in the blood, and this level will be tested to determine the nutritional status or chronic illness. The normal range is 6.0 to 8.3 grams per deciliter. Some signs and symptoms of high levels are lack of fluids, feeling very tired even after rest, stiff joints, and then some signs and symptoms of low levels are fluid buildup causing swelling, muscle loss, brittle nails, and hair. What could your results mean? It could mean dehydration or chronic inflammation. Factors that can affect the results are contrast agents and medications that kill healthy cells as well as harmful cells. Before the test for the total protein, no fluid or food restrictions are necessary, and we are going to review the medications as well. During the test, 7 mLs of blood will be collected, and then after the test, you can resume your medications as prescribed. I know that was a lot, so if you have any questions, please feel free to ask.